Advanced Bioresonance System, a new way of seeing the human body. With multi-layer energetic and informational model. A new lens for understanding the human body. Ladies and gentlemen, every great breakthrough in medicine began with someone asking a simple question. What if there is more to the body than what we can see? For centuries, we believed the body is only physical. Modern medicine added chemistry. Neuroscience added electrical signals. Quantum biology is now adding something even deeper. The informational field that drives life itself. The Advanced Bioresonance System does not compete with medical science. It offers a different lens, a deeper layer, a more subtle dimension through which we can understand the human body. For many people who have tried every medical test, every specialist, every medicine and still suffer, this system provides insight, relief, and a sense of direction. Today, I will explain what it is, how it works, and why so many people feel better after using it. 2. The multi-layer human model, a revolutionary perspective used in bioresonance systems. The Advanced Bioresonance System is built on a multi-layer interpretation of the human body. It does not stop at organs or labs. It goes deeper, step by step. Layer 1, system level. The major body systems: nervous system, digestive system, endocrine system, immune system, circulatory system. This is the level where symptoms appear. Layer 2, organ level. Each organ vibrates at its own electromagnetic pattern. This concept aligns with heart coherence research, EEG/ECG electrical signatures, bioelectric fields in tissues. Layer 3, tissue level. Every tissue has unique conductivity, resonant frequencies, and energy flow patterns, similar to fascial conduction, piezoelectric properties, and microcurrent effects. Layer 4, cellular level. Cells communicate using ions, charge gradients, and oscillations. This is recognized in cell membrane potentials, mitochondrial oscillations, charge-based healing, PEMF response patterns. Modern science increasingly recognizes that human biology cannot be understood through biochemistry alone. Every living system generates and responds to electromagnetic fields, oscillations, and subtle patterns of information. Nerve conduction is electrical. Heart rhythms form coherent wave patterns. Cells communicate through ionic and vibrational exchanges. And measurable bioelectromagnetic fields extend beyond the surface of the body. Research in neurophysiology, biophysics, and systems biology suggests that health depends not only on structural integrity, but also on the coherence and stability of these regulatory signals. When stress, inflammation, or trauma disrupt these communication networks, the body enters a state of dysregulation. Emerging technologies, such as neuromodulation, PEMF, photobiomodulation, and bioresonance systems, seek to support the body by influencing these informational pathways. They do not replace conventional medicine, but complement it by addressing a dimension that traditional diagnostics cannot measure: the energetic and regulatory dynamics that govern cellular function, organ coordination, and overall physiological balance. In this sense, the evolution of medicine is moving toward a broader model, one that integrates matter, energy, and information into a unified understanding of human health. Layer 5, DNA, RNA, chromosomal symbolic level. This is not genetic editing or physical access. It is the informational energetic representation of coherence, resonance, cellular integrity, mitochondrial vitality, genetic expression patterns. Quantum biology already recognizes photon-based DNA communication, biophotons, vibrational states affecting transcription, energy signatures of cellular processes. Layer 6, chakra, biofield level used for thousands of years across. Ayurveda, yoga, Tibetan medicine, Chinese medicine, Reiki/pranic traditions. Now reinterpreted by modern physics as energy centers, field vortices, emotional energy nodes, neuroendocrine hubs. The biophilia X5, Ultra integrates these levels into a single model, offering a holistic map of human function. 3. What the device attempts to do. Safely explained, the biophilia, X. 5 Ultra aims to read electromagnetic patterns in the body, compare them with reference frequency databases, identify deviations that may indicate stress or imbalance, deliver harmonizing frequencies to encourage balance. It does not diagnose disease. It does not replace medical tests. But it acts as a functional energetic assessment tool. Think of it like an ECG or EEG, but expanded into a theoretical energetic model. 4. The science behind the principle. Why frequencies influence the body. Even mainstream science agrees. The body is electrical. Cells communicate through oscillations. The heart and brain produce measurable fields. Light and frequency affect biological systems. Examples: PEMF improves healing. Vagus nerve stimulation reduces inflammation. RTMS treats depression. Photobiomodulation improves brain function. Sound therapy calms the limbic system. Tissue voltage predicts healing speed. So the principle is simple. If the body is electrical, frequency can influence function. Bioresonance uses this principle in its own unique way, by attempting to harmonize energetic patterns. 5. Why people improve. The practical effectiveness. Patients often report deep relaxation, improved sleep, reduced pain, better digestion, emotional balance, more energy, mental clarity, sense of lightness. Why? Because frequency-based therapy often influences the vagus nerve, autonomic balance, microcirculation, muscle tension, limbic system, stress hormones, brainwave patterns. These changes are very real, whether or not conventional medicine has mapped them yet. Patients experience the difference. That is what matters. 6. Areas of application, wellness and supportive use. While not a diagnostic tool, it is used in stress reduction, sleep support, emotional balance, pain and tension, chronic fatigue, digestive discomfort, general wellness, autonomic imbalance, chakra, biofield, harmonization, complementary support for complex cases. It is never a replacement for medical treatment, but it is a powerful adjunct where medicine has limits. 7th, why people believe it. The human experience. People believe because they feel peace, relief, regulation, clarity, calmness, energy, improvement. Many of them suffered for years. Many were told, your tests are normal. Many lost hope completely. Then suddenly, something inside them shifts. They feel alive again. That experience is undeniable. Mitochondria, the core of human health and bioenergetic regulation. One of the most important concepts in modern biology is this: every symptom, every organ dysfunction, every chronic condition ultimately traces back to one source, the mitochondria. Mitochondria are not just energy factories. They are the master regulators of cellular energy production, ATP, oxidative stress balance, inflammation, cell repair, immune signals, brain function, hormonal balance, aging, resilience, and vitality. When mitochondria weaken, the body cannot maintain balance, even when scans and blood tests look normal. This is why many patients feel tired, foggy, anxious, inflamed, weak, in pain, unable to recover, unable to sleep, even though all medical tests show nothing. The problem is not in the laboratory reports. The problem is in the cellular energy system. How bioenergetic scanning fits. Into this systems, like the Advanced Bioresonance System, follow a model used in many integrative and bioenergetic practices. Each cell has an electromagnetic signature. Mitochondria produce measurable oscillations and charge. Energetic disturbance can reflect mitochondrial stress. Resonance-based correction attempts to restore coherence. This does not replace biochemical testing of mitochondria, and it does not claim to biologically modify mitochondria. But at a bioenergetic level, the system tries to identify patterns of low cellular coherence, detect frequency deviations associated with energetic weakness, apply harmonizing signals, support improved regulation at the information level. In simple terms, it tries to restore the energetic environment in which mitochondria thrive. Why this is important in chronic illness. Nearly every chronic condition, pain, fatigue, mood disorders, autonomic imbalance, insomnia, digestive problems, has a component of mitochondrial dysfunction. So, when the energetic environment of the body is corrected, cells communicate better, tissues become more coherent, inflammation reduces, nervous system calms, parasympathetic tone improves, ATP production becomes more efficient, healing pathways. Activate patients feel this instantly as more energy, less heaviness, clearer mind, improved sleep, reduced pain, emotional stability, better movement, renewed vitality. These improvements are subjective but real because the nervous system and mitochondria respond hugely to changes in electromagnetic environment, vagal tone, microcirculation, stress load, coherence, cellular charge. If you improve the mitochondrial environment, you improve the entire human system, because mitochondria are the foundation of energy, healing, and resilience at every level. Ladies and gentlemen, the Advanced Bioresonance System does not claim to replace medicine. It does not claim to treat disease, but it represents something powerful. A new way of understanding the human body, not just as chemistry and organs, but as information, energy, coherence, and vibration. Medicine will continue to evolve, biophysics will grow, quantum biology will expand, neuroregulation will become mainstream, and the biofield will eventually become part of accepted science. What seems unusual today may become standard tomorrow. And through this device, patients who had no answers are finally finding relief, hope, direction, balance, and a sense of being understood. The future of healing is not force. The future of healing is balance, and that future has already begun. Thank you. Holistic Wellness Foundation, IMFAL. Healing Beyond Boundaries.